Hello guys, you are welcome to Everything Medical. Today's video we shall be appreciating the intercostal spaces. That potential space that is found between the two adjacent ribs on the thorax. Before we proceed with this class or this video, if you are coming across my channel at the first time, don't forget to subscribe, like, comment and share our video so that others will also benefit from it. Now let's dive into the class. This diagram here depicts all we shall be discussing on the intercostal space. We shall be discussing those potential space that is found in between two adjacent ribs, right? So here is the cross section or the transverse section of the intercostal space, while this is the vertical section, right? So the first thing is introduction. What is intercostal space, right? Or what are intercostal spaces? An intercostal space is a potential space that is found or located between two adjacent ribs and their costal cartilage. That is the concept of intercostal space. There are those potential spaces that is found between two adjacent ribs and their costal cartilage, right? Now watch this diagram. This is a rib, this is a rib. So you can see that it is a space between two adjacent ribs, right? Because this is an intercostal space, this is a rib, this is a rib. So it is a space between two adjacent ribs. Recall that we have 12 pairs of ribs on the thorax. We have 12 this side and we have 12 this side, right? Automatically we have 11 pairs of intercostal space, right? Because we have 11 on the left side and we have 11 on the right side, because in between the two ribs lies the intercostal space. So when you count from first rib to 12th rib, if you check the spaces, there are 11, right? Because two ribs usually form one space, right? So when you calculate this, you deduce that yes, there exists what 11 pairs of intercostal space, because it is right and left, right? So that is how they are being fashioned. So we have 11 intercostal space located on the both sides, 11 on the left, 11 on the right. So that is how they are being fashioned on the thorax. The next is the classification. How are intercostal space classified? The intercostal space are classified into two. We have typical intercostal space and atypical intercostal space. This classification is based on how the neurovascular bundles of the intercostal space supplies either the structures of the thorax or beyond the thoracic wall, thereby partly or entirely supplying to other regions, right? So as we proceed, you get to understand why they are called typical intercostal space and atypical intercostal space. So we have typical intercostal space, and So, on typical intercostal space, it is being formed by the third to sixth intercostal space. So we have third to sixth intercostal space that forms it. So on the atypical, we have first, second, seventh, eighth, ninth, 10th, and 11th. So these are the spaces that forms the atypical intercostal space. Why is third to sixth intercostal space called what? Called typical intercostal space? It is called a typical intercostal space because the blood vessels and the nerves of this intercostal space supplies the confines of the thorax. They do not live beyond the thoracic wall. They supply to the structures on the thoracic wall. That is why they are being called the typical intercostal space, because their blood vessels and nerves supply to the confines of the thoracic wall. Whereas the blood vessels of the intercostal space from first, exception of third and sixth, to 11th, extend beyond the thoracic wall or, or supply to the other regions. That is why they are being called atypical intercostal space, because the blood vessels of the first intercostal space, exception of third and sixth and 11th, supply to the other regions. They do not supply to the confines of the thorax. That is why they are being called atypical intercostal space. That is how that be fashioned. The next is the content of the atypical intercostal space. Content of typical intercostal space. We have number one, intercostal muscles. We have intercostal muscles. We have three intercostal muscles that are found on the intercostal spaces. Number one, or A, we have external intercostal muscle. We have internal intercostal muscle and innermost intercostal muscle. Which can be called intercostalis intimis muscle. Now, let's depict it on this diagram. This is the external intercostal muscle, right? This is the external intercostal muscle. Intercostal muscle. This is internal intercostal muscle. While this is the innermost intercostal muscle, which can be called intercostalis intimis muscle. Intercostalis what? Intimis muscle. This remains the rib. This muscle here is the external intercostal muscle. This is the internal intercostal muscle. Here is the innermost intercostal muscle. This is the costal pleura. While this is the endothoracic fascia. Right? So, this is how the muscles of the intercostal spaces are structurally arranged. The next content is the intercostal vein. Intercostal artery, intercostal nerve, the number 5, intercostal lymph vessel and lymph node. Lymph vessels and lymph nodes. So these are the content of the intercostal spaces, right? Important to note, the neurovascular bundles of the intercostal spaces are arranged in a plane. They are arranged in a plane between the intermediate and the deepest layers of the intercostal muscles, or they are being arranged in a plane between the innermost intercostal muscle and the internal intercostal muscle, right? Now watch. As you can see, this is the internal intercostal muscle, while this is the innermost what? Intercostal muscle. So they are being arranged in a plane between the innermost intercostal muscle, or the deep layer of the intercostal muscle, and the intermediate intercostal muscle, right? Which can be called the internal intercostal muscle. So this is the intercostal vein. This is the intercostal artery. This is the intercostal nerve. So as you can see, they are being arranged in a plane between the intermediate layer and the deepest layer of the intercostal muscles, right? That is why I said that they are being arranged in a plane, right? So this is the plane. Let's quickly look at the intercostal muscles, right? Let's appreciate it a little. You have to understand that the intercostal muscles are just like those group of muscles that are present in the intercostal space, right? Which does what? Which helps to form and also move the chest wall or move the thoracic cage, right? Because they participate in formation and also in the movement of the thoracic cage or the chest wall, right? That is one of the features of the intercostal muscles. What are the actions of these intercostal muscles? These intercostal muscles provide support. It provides support for the rib and prevent it from separation. If you watch, the muscles are usually binding two ribs, right? So they kind of provide support, providing reinforcing activity so that the ribs will not separate apart, will not depart what each other. So it's a kind of bonding them together. Also, the intercostal muscles helps or it elevates the ribs during what respiration. However, the external intercostal muscles act during inspiration, whereas other intercostal muscles act during expiration, right? So this muscle usually act during what? Inspiration, whereas this and this usually act during expiration. So that is how they works. Recall that these muscles are innervated by the intercostal nerves. They are being innervated by the what? Intercostal nerves, right? Okay. On the area of intercostal vein, intercostal veins are usually the veins that drains on the thorax, right? They drain on the thorax, and we usually have the anterior and posterior intercostal veins that are usually found on the both sides of the thorax, anterior and posterior. Likewise, the intercostal arteries that are being found on the thorax, there are usually two, anterior and posterior intercostal artery. Anterior is usually found on the frontal view, while the posterior is found at the back view, right? So that is how they are being fashioned on the thorax, giving perfusion to the thoracic what? Structures, right? So the intercostal nerve is an important nerve on the thorax. We have 12 pairs of thoracic spinal nerve which supply to the thoracic wall. There are 12 pairs of thoracic spinal nerve which supplies to the thoracic wall. As soon as this nerve leave the intervertebral foramen or foramina, it divides into two, the anterior and posterior primary rami. The anterior primary rami of the upper 11 intercostal, of the upper 11 thoracic spinal nerve, that is from T1 to T11, courses through the intercostal space. Hence, they are called intercostal nerves, right? Because as soon as the anterior primary rami exits the intervertebral foramen, right, it chooses to form the intercostal nerve, because the anterior primary rami of the upper 11 thoracic spinal nerves courses through the intercostal space. Hence, they are called intercostal nerve. But the anterior primary rami of the 12 thoracic spinal nerve courses or runs into the what? Abdominal wall. below the 12th rib. Hence, it is called the subcostal nerve. So, this is it is called a subcostal nerve because it courses along the abdominal wall, right? By passing below the 12th rib. That is why it's called a subcostal nerve. So the 12th thoracic spinal nerve is not an intercostal nerve. It is a what? A subcostal nerve. You also have to understand that the intercostal nerves are divided into two: the typical intercostal nerves and the atypical what? Intercostal nerve. This typical intercostal nerve is in relation to the division of the typical intercostal space. Also, the atypical intercostal nerve is in relation to the division of the what? Atypical intercostal space, right? Because the nerves arising from the third to sixth intercostal space supply to the structures within the confine of the thorax, whereas the one arising from the intercostal space of the atypical extend beyond the thoracic wall, which partly or entirely supply to other regions. That is why they are called the atypical intercostal nerve, right? I believe we have done justice to what intercostal space, ranging from the introduction to classification and the content, right? So thank you so much for staying to the end of this class. I really appreciate.